Hello, my name is Luis Argueso, and I'm a partner and co founder of InHealth Advisors. Thank you for your interest in InHealth's free Making Care Primary, or MCP, revenue estimator tool. Based on feedback from interested organizations, we've heard that there's a significant need for a resource to help primary care practices understand the potential financial impact to participating in the MCP model. We hope that this tool provides a simple way for your organization to understand the revenue impacts of participating in the model. Do note that the values provided in the tool are estimates and not guarantees of results. Additionally, this video will not go into the details of the mechanics of the MCP model. If you're interested in that information, we've linked to some resources in the video description. Let's dive right in and take a look at the tool. The tool contains several worksheets that demonstrate the details of the revenue estimate from the MCP model. The first sheet provides instructions and serves as a handy reference guide for the functionality of the tool. The second sheet is the inputs sheet. Here you can supply the information needed to populate the revenue estimate. The light blue cells are where you can input or select the relevant data. You will note that some of the inputs are dropdowns, while others require you to type in the necessary data. The second section of the inputs sheet gives you the option to use Medicare average values for estimating revenue under the MCP model or using your organization's own data. Do note that if you choose to input the data from your own practice organization, you will need to have revenue at the CPT code level and referenced the linked tables for counting the revenue from the correct CPT codes. Because a substantial proportion of revenue in the MCP model is tied to quality performance, I recommend completing all of the fields in the Quality Performance Inputs section. If you're unsure as to actual performance, you can input placeholder values. Keep in mind that Medicare is still working on defining some of the measures in the model. Since they are undefined at the moment, you can select estimated performance from the relevant dropdowns. After entering all of the inputs, the remaining worksheets in the model will populate. I've used some sample values to show the information the tool provides. The third sheet provides a high-level financial summary of the MCP model. Many of the revenue streams are additive to existing fee-for-service reimbursement. The financial summary sheet provides a clear picture of these streams under traditional fee-for-service Medicare and the MCP model's three tracks. The graph to the right provides a handy visual for understanding the revenue impact of the MCP model. If you're curious about potential revenue under different scenarios, changes to the input sheet will update the financial summary. The remaining worksheets, colored purple, provide detail into the calculations of the various revenue streams. While the precise methodology used here is beyond the scope of this video, you can refer to Medicare's Request for Applications document and the worksheets themselves for greater detail. The first purple sheet provides an estimate of patient services revenue. It shows the revenue estimate depending on whether you opted to use Medicare averages or inputted your own practice information. The second purple sheet shows the estimate of enhanced services payments to support coordinated team based care. The estimate is based on Medicare's projected average per beneficiary per month payment as detailed in the MCP request for applications. The third purple sheet details the calculation of the upside only quality bonus under the various tracks. To estimate performance, we've used the 2023 quality benchmarks reported to the Merit Based Incentive Payment System under the ECQM collection system. The final purple sheet determines if your practice is eligible for the upfront infrastructure payment of $145,000 spread over 2 years or $72,500 per year. We hope this tool fills a crucial information gap in helping practices evaluate whether or not to participate in the MCP model. We invite you to reach out to us if you have any questions about the MCP model or the tool. The value based care experts at InHealth Advisors are eager to help you maximize your performance in innovative reimbursement programs like the MCP model. Thank you for your time.